I am Representative Karen Camper. I serve as the proud president of the National Organization of Black Elected Legislative Women, or better known as Nobel Women. Nobel Women is a nonprofit, nonpartisan organization primarily composed of current and former Black women legislators, as well as many appointed officials. Our mission is to increase and promote the presence of Black women in government. Our objectives are to create programs and platforms to advance Black women in the field of public policy, public service, and civic engagement, to act as a network and support system for Black women in public policy and organizational leadership, to serve as a venue for thoughtful dialogue on issues of public interest between elected officials and stakeholders, and to train and educate a class of cultivated and experienced Black women to assume both governmental and corporate leadership roles. On behalf of our National Board of Directors, I welcome you to this event entitled State of Malnutrition in an Age of COVID-19. This event will address what's happening at the federal level and how our state legislators and community members can advocate for more federal resources on behalf of our most vulnerable communities. I would like to recognize our partner for this event, as well as our sponsor of this event, Abbott Nutrition. They have been a long-time supporter of Nobel Women, and we are happy to continue our work with you and definitely to support us on you and us on issues dealing with this very important topic. The speaker for this event is Robert Blancato. Did I pronounce it correctly?
Blancato's good.
Cato.
Blancato, and Bob is even better too.
Okay, Robert Bob Blancato is the president of Matz Blancato and Associates, a public and government relations firm. He spent 17 years on the staff of the U.S. Select Committee on Aging and has participated in 4 White House conferences on aging, including the executive director, including as being the executive director of the 1995 White House Conference on Aging. With over 30 years of deep experience in the field of aging and public service, he is the executive director of the National Association of Nutrition and Aging Services program and the national coordinator of the Elder Justice Coalition. As a volunteer, Bob serves on the board of the National Hispanic Council on Aging. From 2016 to 2018, he chaired the American Society on Aging. He is a former volunteer state president of the AARP Virginia. He served 6 years on the board of the National Council on Aging. He is a former president of the National Committee for the Prevention of Elder Abuse. In 2019, he was appointed by HHS Secretary Alex Azar to the National Advisory Council on Rural Health and Human Services. Bob was named to the ASA Hall of Fame in 2020. He was knighted by the Republic of Italy in 2011. Bob resides in Virginia. Thank you, and I hope this conversation is informative and moves all of us toward a world without malnutrition. Ladies and gentlemen, I would love to introduce Bob, and I can't wait to hear all the exciting information he's going to share with us today. Thank you. Over to you, Bob.
Thank you very much, President Camper, for that more than generous introduction. And let me also thank Crystal for her help in getting this thing organized and helping to move the slides, of which there are quite a few. And the slides will be available to everyone participating today, so that you can watch and not have to be furiously writing, because it's all yours after the process is over. So let's go to the first slide, if we could. Okay, we'll go now. Okay, so we'll go to the next slide, actually. We'll start with the opening here. So it is a distinct honor to be involved and participate in this event of Nobel women. And since we've just completed a national election, my congratulations to those of you who were elected or re-elected. And now we see, as of 2019, over 300 Black women in state legislatures. I hope this number only continues to increase. My special congratulations to the 22 Black women elected to the 117th Congress, including the chair, Maxine Waters of the House Financial Services Committee. And you could not have chosen a more timely and relevant topic for today, the malnutrition and vulnerable communities in the COVID-19 era. Next slide. I'm also pleased to join you as the national coordinator of the nonpartisan Defeat Malnutrition Today Coalition, which has over 100 members, including Nobel women. We are so proud to have you in our ranks. We were established to raise awareness about malnutrition and especially its impact on older adults, including raising awareness in the Congress of the United States. And we found out yesterday that last Thursday, the Senate of the United States passed S-Res 716, recognizing Malnutrition Awareness Week, officially recognizing it. It passed the Senate. It was authored by Senator Murphy of Connecticut and Senator Grassley of Iowa. And we produced a blueprint, an update of our national blueprint. And one of its main findings is that 1 out of every 2 older adults are at risk of malnutrition or are already malnourished. And we are very proud to have the strong support, as you have, of Abbott Nutrition for our work on our coalition. Next slide. So obviously, what is malnutrition? Obviously, it is what occurs when the body does not get the nutrients that it needs. It is having the presence of at least 2 of the 6 following clinical characteristics below. A part that's perhaps most important is it's linked to chronic disease, which is an issue affecting many, many older adults in this country. And individuals with malnutrition may be overweight, normal weight, overweight, or even obese, but can still be malnourished in that status. Next slide. So obviously, the overriding issue facing us as a nation is the pandemic. Most of us can point to when it began. We wish we could predict when it will be controlled and then end. We know these numbers are staggering in our nation, and we appear to be in the worst phase of the pandemic, with 49 states now showing increases in positive cases. And within the pandemic's impact, we are finding those groups who have been hit the hardest, people of color and older adults, just to name 2. Next slide. And obviously, we have a new focus, which should not be a new focus, it should have been a long time ago, on disparities and its relationship to this issue. And you have to go back to a public law a number of years ago in the Clinton administration, where the legal definition of health disparities was first established. A population is a health disparity population if there's a significant disparity in the overall rate of disease incidence, prevalence, morbidity, mortality, or survival rates in the population as compared to the health status of the general population. This is in law. If we go to the next slide, the study from our friends at the Academy of Nutrition and Dietetics describes diet-related disparities this way. Diet is a key contributor to disparities in many chronic diseases and conditions. Therefore, to address and ultimately eliminate health disparities, it's important to understand how various factors, including diet and nutrition, contribute to these disparities, end of quote. You know, the Congressional Black Caucus Institute, your organization, the National Black Nurses Association have all published items or done resolutions relating to malnutrition in older adults of color. And your resolution in particular, I was very impressed with and found it very helpful in our work when you developed a resolution that included the language about African Americans are more than twice as likely to experience nutrition neglect. And according to a 2019 study just of adult day participants, which features many minority older adults, 65% of Black older adults were at high nutritional risk compared to whites and Hispanics. These are this is real data, real numbers that are very shocking when you look at them. Next slide, please. Actually, that's the right slide. I'm reading the wrong thing here. Sorry. Health disparities, yes, among older adults of color can contribute to higher rates of malnutrition. As it's pointed out before, older adults of color are more likely to have the chronic health conditions. The Centers for Disease Control say African Americans are 40% more likely than non-Hispanic whites to have high blood pressure and are less likely to have this condition under control. The rate of diabetes diagnosis is 77% higher among African Americans and among whites. Next slide, please. Then we bring in the issue of food insecurity, which has such a great bearing on the topic of malnutrition. And it's an economic factor as well as a health factor. Estimates are that over 20% of all adults in this country are food insecure during the pandemic. We have not seen a breakdown by age, but we know all groups are being impacted. There are very few studies examining the racial ethnic disparities in food insecurity or the extent of the pandemic within households with children, but the rates are twice as high for Black families. While only 3%, I found this statistic amazing when we discovered it, only 3% of all counties have a population that is majority Black. According to Feeding America, 18 of the 25 counties projected to have the highest 2020 food insecurity rates are majority Black. And prior to the pandemic, 15.1% of older African Americans and 14.8% of older Hispanics were food insecure, but only 6.2% of white older adults. And as we all know, those numbers are just at the edge of the pandemic as compared to where we are right now. And so in that spirit, let's talk about what's going on in Washington with respect to the pandemic after I do this slide. So case rates have been far higher in non-white populations, and the results are staggering for older adults. As a result of the COVID, African Americans aged 65 to 74 died of COVID-19 5 times as often as whites. 75 to 84, the death rate was 3.5 times greater. And among 85 and older, Black seniors died twice as often. These are real numbers. But let's talk about what's going on in Washington in response to the pandemic. And this chart is very interesting, but it's also not a pleasant sight to see for this reason. It looked at the date of March 26th. That was the last emergency spending bill passed on behalf of Congress and the White House for the COVID-19. That's a long time ago, okay? That's a long time ago. And the situation has grown quite severe since then. And we have been waiting for the adoption of a fourth package, which I'll come to in a minute. If we go to the next slide, you know, our work in our Defeat Malnutrition Today coalition with you has been on the vulnerable older adults and their ongoing need to maintain access to nutrition. You know, back when they passed the first bill, the Family's First bill, we found immediate interest in the Congress, led by Congresswoman Rosa DeLauro of Connecticut, who chairs a very important subcommittee that provides funding for Health and Human Services. Her staff contacted us and our colleagues at Wheels and Wheels America to get an idea in the early stages of what we could expect on the ground relative to the pandemic. And this led to a $250 million in emergency funding just for the Older Americans Act nutrition programs. Because the information that was provided, you'll see on the next slide why the funds were needed, because we were seeing, and many of you in your communities have probably seen this, a complete conversion of the Older Americans Act nutrition program. It used to be primarily a congregate nutrition program and home delivered meal. But when all the programs started to close down, the senior centers, adult daycare centers, and so on, everybody became a homebound recipient of meals. And once this happened, once this conversion happened, it was straining local nutrition budgets. They were incurring additional food costs, transportation costs, and extra staff needed to get these meals to older adults. And then you have the additional issue of the human impact of the big increases in older adults being homebound, becoming also isolated, okay? A great public health issue we have to confront. And recently, I'm happy to say that these emergency funds have been used for telephone and telephonic reassurance programs to check on the well-being of older adults. And we are now currently working to have this expanded to find out which older adults might be experiencing higher rates of malnutrition. Next slide. The bill that followed the Family's First Act was called the CARES Act, and it also provided significant funding for nutrition programs, $480 million to be exact, for the Title III nutrition program. But here's the important thing to remember, that it allows for flexibility in how you spend the money. If you're dealing with a pandemic emergency like we are, you can't be held back by restrictions about how much you can send to this program versus that program. So now you have full authority to transfer all the money you need to where you need it. So if all your money has to go to home delivered meals, then you can do that under the CARES Act. It also says that let's go back. Yeah, it also states that you don't have to meet certain nutritional requirements to provide a meal. And I'll give you an example of that. Many of local programs need to send shelf-stable meals to older adults, okay? And there's only a certain number of companies that provide shelf-stable meals, but other companies that wanted to come in and do that. And now, because you don't have the restrictive language about what requirements you have to meet, more people can get more meals because of the CARES Act now. And also, they changed the definition that includes older adults who are self-isolating in the definition of homebound meals. Now we go to the next slide. In addition, the CARES Act, the bill that passed in March, the last big bill that passed for the emergency, $15.5 billion for the SNAP program, an additional $450 million for food banks and for commodities to be available, $100 billion for hospitals responding to the coronavirus, $1.32 billion for additional funding for health community centers. And then, of course, one of the more interesting developments of the pandemic has been the decision by the administration to waive a number of rules allowing more telehealth and telemedicine to occur, including nutrition counseling for diabetes and renal issues, something that we hope gets made permanent and continues in the year ahead. So the next COVID bill is what we're waiting for. And you're watching this like I am, you're elected officials, you know the situation. You know, everybody wants to know, when is this fourth COVID-19 emergency bill going to emerge? It is horrible to imagine that we have a national emergency of this magnitude that runs into partisanship of the highest order. The House passed its bill on October 1st, a $2.2 trillion bill called the HEROES 2 Act. The Senate tries to pass a $500 billion bill and can't even get it on the Senate floor for a vote. The administration prior to the election kept sending mixed signals. One day the president would say, let's go big. Other days they would say, no, we want to stay small. So nothing got done before the election. So now where are we? We're in a lame duck session of Congress. And what should happen? Well, first of all, a key focus of any next emergency funding bill must be funding for nutrition programs. The House bill that passed October 1st recognizes this and put significant money in for nutrition programs. $500 million just for the Older Americans Act, another $44 million for preventative health programs, which includes malnutrition screening. And also in the House bill, continued flexibility for nutrition programs, the all-important $436 billion for state and local government. You know, this is a big dividing issue between the House and the Senate that's got to be resolved, because there is no state or local government that I know of that does not need this money. And if it doesn't come soon, they're going to be making serious cutbacks in very important programs. The House bill also has a 15% increase in the maximum benefit under SNAP, another $10 billion in overall funding for SNAP, another money for the food banks, and another $2.3 billion for Indian Health Service. So this has all been done by the House. But what happens next? The election results suggest one of two things can happen. Either a giant bill along the lines of the House passed bill could pass both houses in a lame duck session, since the president, the speaker, and the chairman of the Federal Reserve all want a big bill and have stated that many times. Or a smaller targeted bill directed at the programs most in need could get done now, and then you wait till President-elect Biden becomes president and it makes that his first bill he signs into law. But whatever happens, it has to happen soon. Money needs to get out of Washington into communities now. Let me talk about a couple of other policy priorities from the nutrition side of things. Next slide after this. So I've been talking about the Older Americans Act. It's a program that all of you from Nobel know about. It operates in your communities. Many of you know the Meals on Wheels program. It's under the Older Americans Act. You know, one of the rare occasions of bipartisanship that happened this year was when the president signed the 5-year extension of the Older Americans Act into law earlier this year. And it reaffirms and strengthens the nutrition program, provides a 35% increase in funding for all the programs in the Act. And in a nod toward modernizing the program, it made a couple of important additions. Next slide. One of the most significant nutrition improvements in the bill was championed by Congresswoman Bonamici from Oregon to have first-time screening for malnutrition as a part of broader nutrition screening, so that now we can look at disease prevention and health promotion to include screening for malnutrition, which has not been done before. Very significant development in this new law. Also, next slide, the reauthorization also adds, for one of the purposes of the nutrition programs, to reduce hunger, food insecurity, and malnutrition. Okay? They have to be linked together. They're all serious issues that affect older adults. We focus on hunger, and we should. We focus on insecurity, and we should, food insecurity. But we need to focus more on malnutrition because it has deeper health impacts. So now this is built into the Older Americans Act, in addition to having the program promote socialization and promote the health and well-being of older adults. Next slide. Now, what's going to happen when they implement this law on malnutrition screening, it's going to be different state by state because the federal government does not have the authority to mandate which screening tests can be used and how often. So one of the things we like to see you do is advocate for your state to select a scientifically validated tool that is easily to administer. There are some out there, the MST and the self-MNA, depending on who's performing the screening, and just make sure that the screening gets done starting in the year 2021 as the Older Americans Act asked be done. Next slide. This is something that I'm sure that you in the elected world understand very much. You know, in the world we're in today, data drives dollars. If you don't have decent data, your ability to try to get more money is very difficult. And one of the things we don't have in this country is malnutrition data that we can rely on. So it is time that either the Department of Health and Human Services or the Department of Agriculture, they need to start collecting malnutrition data. And we need to have the Administration for Community Living, or ACO, collect overall data on nutrition risk that's gathered every month by local programs. You know, and I'll give you the parallel because you mentioned, President Camper, that I run the Elder Justice Coalition. For years, we have been held back in our ability to fight elder abuse because we have bad data. We don't know the incidents. We don't know how many cases there are. And year after year, we fight that battle. And we're trying to get better data, and we need it in this area as well. And so we hope this can happen in 2021. I want to turn next to a report that came out under our auspices that we requested from Senator Murray and Senator Casey, Murray of Washington, Patty Murray and Bob Casey from Pennsylvania, who asked the Government Accountability Office to take a look at the status of older adult nutrition programs and were they in fact doing the job they were supposed to do. And they spent a lot of time, 18 months on the report. They interviewed experts and visited 25 different locations. And one immediate takeaway was their recognition of the link between nutrition and health among older adults. Next slide. And their findings included the fact that existing programs do not sufficiently focus on the nutrition needs of all older adults, especially those with chronic conditions. Nutrition providers, and this is before the pandemic, remember, are being challenged by the growing demand for medically tailored meals and meals reflecting cultural and religious dietary preferences. If you don't have attractive enough meals or relevant enough meals for people, they're not going to come to your program. We need to have more medically tailored and cultural meals. And then neither Department of Agriculture or the Department of Health and Human Services are doing enough oversight and monitoring of the meals that are served. We should never forget this fact. It is more than just a meal, but the meal is still very important, and it must meet nutritional requirements going forward. So the next slide tells you what the GAO, the Government Accountability Office, recommends. More oversight and monitoring. You know, we have a cycle every 5 years. We update our dietary guidelines in this country, okay? And the next group of dietary guidelines are under the auspices of the Department of Health and Human Services. The GAO is saying we need to have this focus on older adult nutritional needs as a major feature of our new dietary guidelines. They also said HHS needs a centralized location for information on meeting nutritional needs of older adults, and that the Department of Agriculture needs to better disseminate existing information on nutrition needs in the child and adult care food program. Very simple recommendations, very implementable, and we're going to keep working on that to happen. And the benefit of this report will be we should end up with more nutritious meals being used with federal funds. There's something wrong with the notion that federal funds being used to not provide nutritional meals, but this can help us get to that point. It also puts the burden on the federal agencies to do a better job of monitoring, but it also sends a key message to Congress that increased funding for key nutrition programs is needed so that the different nutritional needs of older adults can be better met, especially in the area of medically tailored and culturally diverse meals. And those of you who are involved in this space understand that investments in senior nutrition always provide a good result. And I'll give you one perfect example. The average age of a person who goes to and gets a meal at a congregate site when they could do that in this country is about 78. And the average age of a person getting a home delivered meals is 82. They've been eligible to this program for 15 or 20 years. You compare the cost of a home delivered meal to a day in a hospital or a nursing home, and you can see why investing in nutrition saves the federal dollar considerably. Let's go to the next slide and next area of focus, fiscal year 2021, which we are now in. It began October 1st. You know, and as always, as those of you who understand how Congress works or doesn't work sometimes, when October 1st happens, none of the budgets are ever done for the federal agencies, so they have to pass what's called a continuing resolution to ensure funding continues and the government doesn't shut down. Well, that was passed, and we are now under it through December 11th. But going beyond that, we're somewhat limited this year in how much increases can be done because of some budget agreements from last year. But right now, the goal is to replace the continuing resolution with an omnibus package agreement. And both the Senate have put out numbers for us to look at, and they're in the next slide, you'll see a chart. And you can see the difference in funding levels proposed between the House and the Senate and current funding. So the column on the left, which says FY20 final, that's what you're currently getting in these programs through December 11th. For anything to change beyond that, Congress has to extend that continuing resolution or pass a full year funding bill. But as you can see, there are differences between the House and the Senate in funding levels. And so advocates like ourselves are saying we want the higher number across the board for all these programs, because each one of these programs addresses nutrition in one form or another. So that's why I'm glad we can have these slides available for you so you can have these charts to look at the difference between the funding levels. Let's go to the next slide. Also in the House of Representatives bill for Department of Health and Human Services, they included some language in there which expresses their concern about older adults who are homebound during COVID-19 may not have regular access to food, putting them at an increased risk of malnutrition. And the House committee understands that malnutrition was included as a part of the Older Americans Act. And they're urging, as I said earlier, they're urging that we use proper nutrition risk screening tools that better capture people at risk of or have malnutrition so we can address that issue going forward. So this is Congress telling a federal agency to get moving on this particular issue. So let's go to the next slide, and we coming near the end here. What can you do? Well, you know, you have a dual benefit. You're an elected official, and you're much closer to the day-to-day issues of your constituents than perhaps people are here in Washington. And in this pandemic emergency era, the information you can gather from front lines of people who are serving people or the people themselves who are being served can be converted into stories to shape policy. And I have seen this over and over again in the first two emergency bills. And let me put it in another context. You know, sometimes it can take months for funding bills to get passed in the Congress of the United States. In about a month and a half's time, two bills, well over $3 trillion, passed the House and the Senate and were signed by the president. So how did they get to the numbers that they got to? They went out into the communities and asked people who are running associations, who have membership organizations. They said, tell us what's going on the ground. Tell us what costs we're going to incur. Give us real life stories. That became the basis for policymaking. Okay, it wasn't long studies and long reports. It was about real life experiences. And that's what happens when you're in an emergency. A lot of rules get sort of relaxed in developing of bills, but you're in a great position to help in that because of the relationships you have with your constituents. And so now we need your voice to get that fourth emergency package done, and preferably with the nutrition and funding levels in the House bill that was on the chart earlier. What else can you do? Next slide. Something that sometimes gets overlooked in the process. It's one thing to advocate for money, and we all do that as best we can, but then you also have to follow the money and make sure the money goes where it's supposed to go. I read a report the other day in the Washington Post that talked about some of these programs in the CARES Act where only 30% of the money has been spent. you are going to have a hard time convincing people in Congress to continue emergency funding for a program if you didn't spend the money you got the first time out. So that's why following the money is so important. See where it goes from Washington to the state to a locality, and make sure it gets to where it's supposed to go. And if it doesn't get there, initiate direct contact either with your congressional delegation or the federal agencies that's responsible for making sure that money gets where it's supposed to be. And on the malnutrition front, we can especially use your help. And next slide. Here's an area where we could be very direct with asking for your help. Those states in the red have adopted resolutions creating Malnutrition Awareness Week. Then you have state agencies promoting Malnutrition Awareness Week in the blue, and then states with proclamations and state agencies promoting Malnutrition Awareness Week in the purple. So take a look at that. So when I go to the next slide, if your state's not included on this map, can you commit to introducing legislation to create a state entity that can develop a strategic plan to promote malnutrition? Or can you author a resolution to formally recognize Malnutrition Awareness Week 2021, as the Senate of the United States did for Malnutrition Awareness Week 2020? You know, if you work with those providing nutrition services, especially for older adults, and encourage them to use the scientifically validated malnutrition screening tool in the future. Another thing we ask you to try to do. And finally, we ask for you to help us in Washington raise our voice about malnutrition and how to prevent it. Because after all, it is about what you eat. So let's make sure that we're doing all we can on behalf of nutritious food being available and accessible to all. And the final slide that we'll leave up is a resource slide that, you know, gives you places to go get deeper information should you want it on some of the points that I made. And on that note, I would say thank you very much. And I don't know whether or not we have questions from folks, but I'm happy to answer them if so. And thank you again, President Camper.
Thank you for that great presentation, man. That was a lot of information to take in, and I'm sure people were taking copious notes and probably will have questions. So I'm going to ask members, if you have questions, just raise your hand and let us know, and we can get the question answered. Or if you just have a comment about what you may be experiencing in your own districts and your own knowledge that you have about this subject would be helpful. I have a question or maybe a comment around, you know, you talked about disparities and the things that are happening over several years, I would say decades of disparities in terms of the health and wellness of the Black population. And so because of this systemic disparities year after year, it's just baked almost in to the system, what can we do, you know, to try to turn the tide on that? Because like you said, with COVID-19, we're disproportionately than anybody else. And as a result of these years of systemic disparities, it's a heavy lift to try to move the needle on this. And I appreciate the recommendations, but do you think that there is some tie to that unresolved disparities that's got us in this position we're in right now?
Well, that's a good question, and I'll say two things. One that's immediate in nature, and that has to do with the vaccine. Okay, because, you know, there's been promising developments that you've heard about this week from the two companies, Pfizer and Moderna, about the success, you know, the rate of success, if you will. It's very important now to ensure that people of color and older adults are in the clinical trials that will produce this vaccine. Because one of the issues people are very concerned about is the confidence issue. You know, will people be confident enough to take the vaccine? Well, one of the ways you help encourage confidence is to demonstrate that your community was in the clinical trial. And we both know that people of color and older adults have been underrepresented for years in clinical trials. This is a unique opportunity to address that issue. And I feel fairly comfortable that the companies involved who are in this race for the vaccine are cognizant of this issue. Now let me add one other piece to the thing. Vice President Biden and his platform, there's a strong series of language about health equity in his platform, in his positions. That is an overriding cross-cutting issue in the Biden policy campaign. Health equity means, among other things, addressing healthcare disparities and correcting them. But if you don't start by addressing and saying we need health equity to be achieved the following way, it's not going to happen. You have not seen that happen in the past. You need to see, for example, a much greater emphasis, funding, power given to the Office of Minority Health in the Department of Health and Human Services. It's a good office, but it's not, it's not at the top of the power list, if you will. But if we're going to start addressing it, they have the resources right in that office to go after this. But it requires White House leadership. It requires White House commitment. And I encourage people to go and read the Biden-Harris platform. It's there. It's very clear. They've made it a priority issue. And then, of course, once it starts, maybe Nobel has some people that could go on the transition teams for this administration. I hope they do. And let's first of all hope that we get to the point where transition gets back to normal. We're waiting for that, as you all are. But, I believe in the theory of infiltration. Infiltration always works. If you're inside, it's a whole lot better than, waiting for somebody else to get your message across. Or the other saying I remember is, if you're not at the table, you're on the table. And, in this situation, you want to be able to put forward, and Nobel's got to be in a unique position because of having all these elected legislators in your ranks. Your voice is much more effective in that situation. So those are the two things that I would encourage. Okay. And I would really, maybe it's adopting a resolution of some kind in the course of some of your work that conveys exactly what you said, what you want to see happen, how you see it want to be addressed. But I really would go after the vaccine thing as well from two perspectives. The clinical trial is certainly one of them, but how do you determine, and this is a presidential decision, how do you determine who gets it first?
Who gets it first?
Right. And believe me, those people who have suffered the most should be the ones who get it first. And I'm especially sensitive to the issue of disparities in older adults because they've gone through a lifetime of it. Okay? Yeah. And that's got to be addressed from that perspective too.
Thank you for that. I think Senator Moore has have a question. Senator Moore? I think unmute her. There you go.
We're good. Thank you for your presentation, and thank you for bringing this to us also, Representative. I had a question regarding, you're talking to people from many different states. I'm in Connecticut, and I've not had this conversation about malnutrition. I do chair aging. I don't chair aging, I chair human services, so some of this could come under human services when you start talking about the CARES Act, the money that's being funneled to feed many of the seniors who are on Medicaid, and that comes under our Human Service Committee. But I was wondering, do you bring this down to a local state where I could have you do a presentation for human services and aging members? We haven't decided who's on what committees yet. I know I'm not going to be the chair of aging, but I will be the chair of human services to bring this to that level so we could figure out how we apply it here in Connecticut.
I would be delighted. I will be happy to communicate with you when you're ready to do such a send an invitation, because I will tell you, I have wonderful relationships in your state with people running nutrition programs, many of whom have and Rosa DeLauro well, I'm sure, and Senator Murphy, as I mentioned, is the author of the resolution that passed the Senate to declare Malnutrition Awareness Week, officially recognizing it. So I'm more than happy to help out, and I will tell you some of these stories we got on the ground from places like Waterbury and Danbury and other places, nutrition programs, helped to shape the decision to put the dollar amounts that were put into the emergency bill so far for the Older Americans Act nutrition programs. So it is all about the information you get on the ground, because who better, right? I mean, they're the ones who are out there every day talking to the older adults, Maybe it's a different conversation than it used to be. It used to be they could go to the senior center and have the conversation with them as they sat at a table and had lunch. Now it's about going to the door and doing a contactless meal delivery. But at the same time, you have an additional responsibility to make sure that you're connecting with those folks that are homebound for now. And that's why there's such an attention being focused on telecommunications and telephone reassurance and telemedicine as a means of saying, if we can't see each other, let's at least have the ability to talk to one another. So I'd be more than happy to share whatever I can with your folks up there.
So I'll get your contact information, and we've got to look at December because we're starting to put together the January agenda.
Okay.
And people need to understand what they need to bring to the table, start thinking about in the way of legislation. I do like the idea of working with both those committees in AARP, who I can get them to make sure the committees come together and it doesn't come from one person.
Oh, I'm more than happy to. I'm on their board, the national board of AARP, so I'm sure that you'll have no problem getting them involved in this. They care a lot about these issues.
Well, thank you. Thank you for this information.
You're more than welcome. And again, I remind everybody who's still there, these slides are going to be available, all 35 of them, whatever they were, for your use beyond today. And I'm happy to share them with you.
Thank you. Does anyone else have a question? Thank you, Senator.
Hi. Good afternoon, to all of you. This is Representative Scott from Georgia. I definitely have not delved into the malnutrition part of this at all. So thank you for this presentation. It really have opened up my eyes, but I know that we have the Meals on Wheels, and I know that we have several other programs in Georgia. But do you have any insight on where Georgia is with these type of programs for our seniors, definitely in the age of COVID?
I mean, I don't have terribly specific information other than, your state does receive and it has an aging network that's very active in providing services to older adults through the Older Americans Act, through other block grant programs. I mean, for example, I don't know if your area is Atlanta, but the Atlanta Regional Commission is one of the gold star local agencies running programs for older adults and has been for years. And the woman who runs it is a woman named Becky Kurtz. And, I'm happy to connect, you with her. There's some other folks in other areas of your state that have been working in older adult issues for quite some time. So maybe we should do is swap some information, and I'll share with you some contacts that maybe you could benefit from.
Okay, thank you, Representative Scott. Did you have a follow-up?
Yes. I was looking at it when we talk about the resolution and as well as legislation that we can introduce. Trying to figure out, do we know of any state that have legislation that dealing with these type of issues recently? Do we just need to read and create legislation to deal with this malnutrition?
Right. I understand. Yeah, I'll tell you what, we have I referenced a blueprint that our coalition has done with help from Nobel and others. We have a state toolkit as well on sample language you can use for a resolution or a bill that you may want to introduce. I'll make sure that Crystal gets that maybe for full dissemination to your group, but I'll make sure that you get one in particular, Representative Scott, because we have seen where states like Ohio and Virginia and Connecticut and Massachusetts in particular, have examples. Some created governors' committees on malnutrition, some do Malnutrition Awareness Week. But this document will give you some sample language you could use should you want to be in a position to introduce such a bill or a resolution.
Okay, thank you for that. Thank you, Representative, for your questions. And yes, please send us that information to Crystal, and we will get it out to the entire body, because I know members are getting their agendas ready for next year, and it's
Yeah.
probably one that's going to be in our resolution process coming up in October. So, I
Happy
mean,
to.
December. We didn't have our October conference. All right. Anyone else? Did anyone else have a question or comment for Mr. Blancato? I have a question around this conversation around isolation.
Mhm.
And so when a lot of the day center programs and a lot of that went away, it'd be interesting to know how long that's been. I think you said it, but over a period of time with this elderly people being more isolated in the home by themselves, no real interaction, children are gone off living their life, no intent, no harm intended. But can you talk about the mental health impact that this may have had on the elderly population, being so isolated at home by themselves? And at one point, some of these constituents were getting the Meals on Wheels, so there was some interaction, but not a lot. But then when that kind of was pared down because of resources, some people, don't even have that anymore.
Yeah, good question. And I've spent a lot of time looking at that because it is a related issue tied to nutrition and the meal situation. What providers are doing as best they can, okay? If you're not in a situation where you have the ability to make real contact with the person getting the meal on a home delivered route, what you do is you make an arrangement to have them called or FaceTime or whatever they decide they can use, so that you're making contact with them at least a couple times a week to check on their status. That used to be what you could do when you dropped the meal off physically in the home or the apartment, whatever it is. And some programs are still finding ways to have, I've seen programs where the person, the older adult comes on the porch and the person, puts the meal on the table, they come out and get it, but there's still a conversation, long enough to say, how are you? And if that person who normally comes out doesn't come out, that's a cause for concern, and you make a report accordingly, and so on. There are fabulous adaptable programs going on around the country to address this particular issue. But the fact remains that we have an epidemic dealing with isolation and loneliness. One of the things that I personally, and hope I can get some support on this, I think what we need to do, because one of the things that the Vice President Biden and Senator Harris have said, we have to invest more in public health. We've learned that as a result of this pandemic. And one of the things we need to do, in addition to that, my hope is that we can make social isolation a public health emergency, because it is. It confronts people of all ages, of all backgrounds, and you need to commit resources to find ways to address that particular issue. And whether it's expanding telehealth and telemedicine so that it can get into more homes and there's more of an ability to communicate with social workers, with physicians, with nurses, whatever it may be, and beyond family members. But as you well know, and a lot of your Nobel members know this as well, it's great to expand telehealth and telemedicine, but if you don't have access to the internet, what good is it?
Right.
You're not closing the digital divide and you're not making it available. So one thing that I'm very impressed with so far, again, in what I've seen in the Biden-Harris approaches, is every time they talk about addressing and expanding telehealth and telemedicine, they talk about closing the digital divide so more people can get access to it. So there's a number of strategies involved, but I can assure you that social isolation has gotten a lot of attention. And I would also recommend our AARP Foundation has done a lot of work in that space. And if you go to their website and just look up some of the reports that they've done, they frame the issue very well. They give some examples, but they also talk about what we can be doing about it going forward. But I assure you, from my vantage point, I know the degree of concern about this issue, and I'm confident that it's going to be addressed.
Okay. Thank you. Anyone else? Okay, go ahead, Representative.
Let me say that, matter of fact, I was just speaking with one of our agent representatives this morning. She called and she was telling me about the program that ARC have with, they have teamed up senior citizens to go out and be partners with the isolation of senior citizens. So they have like 5 people that they go out and they, you know, go by, talk to them, call them and talk to them.
Right.
It's a program that the ARC here have started with the seniors. So, you know, that is something that we probably could look at also, trying to find people that you was telling me about the extensive program, and, you know, they had to go through a background investigation of everything to be part of it because you're dealing with seniors. So,
Yes.
you know, maybe that is something that, you know, we could look at and see how can we get people involved in those type of programs.
Right. And the ARP Foundation has a program like that as well, where people sign up and commit to making phone calls to people on a regular basis to maintain contact. And I mean, this is, you know, as I said before, and ARC, Atlanta Regional Commission, is a perfect example of it. But I'm sure in all of the areas that you're from, if you just tap into your area agency and aging or local aging service provider, you'll find that many of them are adapting their programs to address this issue. Because they understand more than anything else, it's about the older adult first, okay? And whatever that the older adult is in need of, they want to be able to provide. And, you know, I'm very impressed with how they have adapted to the environment that we're in, which is a very difficult one. But at the same time, I'm sure you would all agree that we look for the day when those congregate sites can reopen. Because I've done work in this area, and I know for a fact that when you ask older adults who sit in lunch programs in senior centers and adult day, and you ask them why do they come, you know what the answer is? It's not for the food, it's for the socialization. And we have got to make sure we do everything properly, safely, but keep a commitment to reopen these facilities so older adults can go back to where they were before the pandemic.
Thank you, Representative Scott. Anybody else have a question or comment? I have another question around, I heard in one of your slides, you talked about medically tailored meals.
Right.
And I think
religious.
Yeah. Could you expound on that? Because I don't know if I missed that you were saying that we've moved a lot toward that, or we need to do more in that. Can you talk a little bit more about that?
It's actually a combination of the two, but we need to do more is the bigger takeaway. I mean, the Government Accountability Office in particular noted that there was an increase in the local programs that were addressing and offering medically tailored meals or cultural meals with some degree of sensitivity. And, you know, they talked to nutrition providers, and they said specifically in their report, nutrition providers are being challenged by the growing demand for medically tailored meals and meals reflecting cultural and religious dietary preferences. Now, you know, this will be the Older Americans Act, which is a main funder for older adult nutrition, has new language in this 2020 bill, again, encouraging where it's needed or where it's wanted to have those kinds of meals available. The issue comes to the point of cost. Okay, because sometimes there's an issue involving being more expensive to do this kind of meal versus that kind of meal. But traditionally, you know, when the demand is sufficient, the funds will follow. Okay, so it's a matter of making sure that as this movement begins to take steam, that gets reported back to people in Washington who make the decision about how much money will be given each year to the Older Americans Act Nutrition Program. And I'm certain of the fact that if the growth continues in those areas, and there's one other factor to keep in mind. That's also an investment. It's not just an expenditure. If you're providing a medically tailored meal, that's a preventative health tool, okay? Because you're keeping that person at home or in their community. If you're providing a culturally sensitive meal, that means the person's going to come and get that meal. They're not going to stay home and be isolated and not eat. So there's a lot of benefits for this whole thing. But it's a relatively new area of focus. But I am particularly happy that the Government Accountability Office recognized the need to have this be part of the future direction of nutrition programs for older adults. And you can be sure that we will be advocating for that up here as well.
Okay, thank you. I appreciate that. Because I believe that I believe like you and them that can go a long way, but also was seeing cost increase associated with it, and
Yeah.
how do you determine from a health perspective what meals for which constituent and how that will work. But I imagine they got the details on how to make something like
Well, they
that
have the
work.
details, but I think you can make it a political issue, frankly. I mean, if enough people are saying, our services could be improved if we had this kind of access to this kind of meal, they communicate that to their legislators, things will start to happen. And, the other part to remember is that, the cost benefit piece of this thing is pretty clear. I mean, you
Yeah.
spend the money now, but the benefit down the road
Is
in saving Medicaid
great.
and Medicare is significant. So
Yeah, very good. And anyone else? So my last question is around, or comment is around poverty. Because so many of our urban centers, we have a lot of people in poverty, and we have a lot of African Americans in poverty, to include some of our seniors and our elders who are trying to help take care of their grandchildren, and now happen to be really spending a lot of their limited resources that they do have, that they sometimes will forego nutritional value for themselves to make sure their grandkids and stuff are fed and things like that. Have you all seen any data around the impact of poverty, disparities, and all of these things together that is causing this ripple effect on the health of the African American community?
Yeah. The answer to your question is that data is emerging on a weekly basis, frankly, as data comes up. Poverty rates have definitely gone up as a result of the pandemic for any number of reasons, including things like loss of employment, and things of that nature. But one thing that I think is very important to point out is that people need to make sure that they are getting the programs to which they are entitled, okay? And programs like access to benefits, things of that nature, the National Council on Aging does, and other programs have as their specific purpose to make sure that people are able to get that vitally important program that could make a difference in their life. So like we take the SNAP program, the old food stamp program. As recently as 5 years ago, only 1/3 of eligible older adults were getting SNAP benefits. So they passed an amendment to the Farm Bill to say we got to increase our outreach and our ability to find these people and get them enrolled in the program. That's one example, but there are other examples like that as well.
Let me stop you right there, because that's a very key point you're making. What I've noticed is, at least in the state of Tennessee, and with elderly people in particular, the forms that they send people to fill out, they mail them a package of 26 pages of information that seems intimidating to some of these elderly people, particularly if they don't have family right there to help them, fill it out or whatever. And then you have this elderly population that's also, some of them have early signs of Alzheimer's, dementia, and stuff like that. So they're not remembering even where they put that package of 26 pages in 2 languages. So somehow I think we need to streamline that process. If you've been qualified before, and the next every year you got to recertify and all that, you don't need 26 pages of information for an 80-year-old person. That's very frustrating. So I think that they get intimidated by it and say, forget it. And they just don't.
No, you're right. Yeah, that's a very valid point. You're right. And there's been efforts made to try to facilitate that process. It needs to be addressed. And I think that the new administration needs to be made aware of the reality of what you're just talking about. Because, and the other issue is some people say after all this paperwork, well, how big's my benefit anyway? How big is it? Is it worth me doing all this work? And, so it's a combination of different things that have to get done. But one of the things we got to figure out is you still need access to people who are willing to help you with those forms. And we can't lose that. We have to find a way to keep that kind of process going.
Correct.
And, hopefully you might have, that kind of story, believe it or not, would be love to be told up here. if you present that to people up here in Washington.
Okay.
We're trying to figure out answers to some of the
Okay.
pressing issues before us. And I hope
Okay.
you'll convey that.
I will do that. And I think, you know, because we've moved away from some of the day centers and stuff like that, which is a place where you could go and bring that piece of mail and say, hey, I need help. You know, at those centers, they probably had people and volunteers that were there available. But since that has kind of gone away in a major way, I think that's had a ripple effect as well on it. So yeah, okay. I appreciate your feedback on that. Anybody else have a comment? Question? Okay, well, thank you,
My
Bob,
pleasure.
so much. This has been wonderful, very enlightening. I'm sure our members and people across who's watching on Facebook have appreciated all the information you share with us and are taking this information back into their communities. And I know the members are probably thinking about what's the best way for them to take it back to their state houses. So
Right.
if you'd like to make some closing remarks, I really appreciate it. Thanks.
Thank you. Well, now that Crystal and I are friends, we will stay in touch with each other, and we'll be happy to answer any other questions that folks might have after the fact, okay?
Okay, thank you so much.
And I wish everybody a happy Thanksgiving in your group, and nice working with you, and thank you for joining our coalition, and we look forward to a good year together.
Absolutely. Thank you. Great information.
Have
We
a good one.
appreciate it.
Thank you.
Have a good one. Happy Thanksgiving.
Happy
Same to you.
Thanksgiving.
Bye-bye now. Thanks, everybody.
All righty.
Thanks, Representative.
Thank you.